Good afternoon, everyone. My name is Dr. Raquel Romero, and I will be the facilitator for the ECHO session today. Thank you for joining the Communicating with Confianza Health Literacy ECHO. This ECHO is brought to you by Health Confianza team in collaboration with UT Health San Antonio Super Hub, the YWCA, South Central EHEC, and the University of Texas at Austin. For those that are unfamiliar with who we are, Health Confianza is a community-wide health literacy program that aims to provide health literacy, education, training, resources, and workforce development for Bejar County and the surrounding areas. Our team believes that health literacy is critical, that it's very important to transform health and achieve health equity for all. Sessions build upon each other, so we highly encourage to attending each session to have an enhanced and holistic learning experience. So please plan to come and join us to see what we have been prepared for you. The ECHO session has different core elements. We have introductions, then we have didactic, we have a case presentation. The second half of the ECHO session is devoted to have and to encourage everyone to participate in dynamic discussion related to a real life scenario presented for our community member. And to ensure privacy, please note that no personal information is allowed to share at any moment and at any point in this session. So what is personal information is DOBs, days of birth, addresses, appointment, etc. Before we go to the introductions, I have some notes I need to share with you. Please ensure your name, put your name in the chat, and this is for our attendance records, your name, affiliation, and email address. And thank you so much for doing that. And ensure that you rename yourself and the Zoom that reflects your first and last name. And please stay muted unless you are speaking, but we encourage to participate in the discussion today. So I invite you, if you feel comfortable and if you're able to do, please join us by video, particular and discussion part of the session. And if you have any connection issues, please send a message to our ECHO IT Cato for assistance. So I would like to move forward the introductions to our hub team. And we have Dr. Rosenfeld. He is going to be our lead specialist. Dr. Rosenfeld.
Hi, good afternoon, everyone. I'm Jason Rosenfeld, Associate Professor in Department of Medicine at UT San Antonio and Co-Director of Health Confianza. It's wonderful to share the next hour with you all today.
Thank you so much. Dr. Rosenfeld, Dr. Melanie Stone.
Good afternoon. I'm Melanie Stone. I'm an assistant professor in our Department of Family and Community Medicine and serve as the co-director of Health Confianza. It's great to see you all. Looking forward to it today.
Thank you very much. I saw earlier Dr. Adelita Cantu.
I think she had to jump to another meeting, Raquel.
Thank you so much, Dr. Rosenfeld, for that. Dr. Cantu is also part of our hub team. And then so we have the pleasure to have Dr. Fisher. She is going to be our didactic presenter and case presenter. Dr. Fisher, if you would like to introduce yourself. And you are muted, Dr. Fisher. Thank you so much.
And there you go. I thought I was unmuted this whole time. Thank you for that. I'm Dr. Jennifer Fisher, and I am a registered nurse as well. I teach at UT San Antonio School of Nursing. I'm an assistant professor, and I do both didactic or theory and clinical learning as well.
Thank you very much. And finally, I just would like to say thank you, everyone, to join our session today, to make this one of your priorities. Thank you. We enjoy to having you today. And ECHO is all teach online environment, so we encourage everyone to participate in our discussion today. With no more from my end, Dr. Fisher, on your time.
Okay. Well, thank you so much. I'm excited to be here today. I have never attended an ECHO presentation or Health Confianza event. And so when Dr. Cantu came to me, I was ecstatic. I am a huge advocate of those with disabilities. I have 2 children with disabilities, and I myself have a disability. So this is a very near and dear topic. I'm excited to talk to everyone today about how we can be more inclusive when it comes to spoken language and written documents. And so with that, we're going to get going. If you see me looking down, it's because I have notes and I also have a timer so I can keep myself on track. So just know that I've got stuff going all over the place, but today's presentation, say it so everyone belongs, but that also includes writing it. So I'm going to share some best practices and lessons that I've learned over the last 28.5 years. Next slide, please. So this is just a little overview of what we're going to dive into today. These are important topics because they do help everyone to create an environment where everyone can feel like they belong. And that is huge for me. So first, we're going to talk about inclusive language. Then we're going to talk about using inclusion when we are making written documents. And then we'll have a small discussion. And then we will do a case study and activity that I am so glad they support y'all interacting with me on. And I changed all the names and a few certain things that won't affect the story, but I think it'll be very helpful. So with that, let's get started and see what we can do to make everyone feel like they belong. Next slide, please. All right. Some notes on disabilities. Many of you are going to be aware of this, but I like to say it just as a reminder so that we can keep it at the top of our minds when we're talking about disabilities and inclusion. Disabilities can be something we have when we're born, or we can acquire it at any point in our lifetime. And so many people who are new to working with the disability population, or those with disabilities, tend to forget that. And so we want to remember that at all times. We might encounter someone who we knew 5 years ago and we lost touch with them, and now we get back in touch with them and now they have a disability. We want to make sure that we can make that leap. Disabilities, they can be physical, they can be sensory, they can be intellectual. There's a whole host of disabilities that no one can see. And just because we can't see someone's disability, that can actually make things worse. So we want to try and be very attentive to the fact that not every disability is visible. And we don't want to mistakenly identify someone as not having a disability just because we cannot see it. Little fun fact that I like to let everyone know, it blows the minds of my students every time I say it. Disability actually affects 26% of the United States. So when you think about that as a whole, that's more than 1 billion people in the United States that are affected by some sort of disability. And it can be something very minor or it can be something very big. So when we talk about inclusion for individuals with disabilities, we're talking about a very large population, as many of you are aware. Next. So what is inclusion? Inclusion is exactly what it sounds like, but if you're not sure what all that encompasses, especially if you're new to working with those with disability, or maybe you're just trying to find ways to be more inclusive, we want to find inclusion is just a way of making everyone feel like they can be a part of the conversation, the activity, the environment. It's finding ways to take differences between individuals and respect that they have differences and include them in whatever way, shape, or form that might be. Everyone deserves to feel, enjoy, and be a part of the world that we live in their own unique way. And that is what inclusion is all about. My 2 children have heard me say this a lot over their lifetimes. They are adults now, but they've heard me say that just because we have a disability doesn't mean we can't do it, whatever that may be. We simply need to do it a different way. And so we have done all sorts of things over the years in a different way. And that's why I am so passionate about this. So we want to make sure that instead of just being an encouraging voice to those with a disability to try something new, that we're actually helping lead the charge. We want to help them find ways to adapt. We want to do things on our side as healthcare workers to make those adaptations even easier for them. And sometimes people don't think about this, but adapting ways for people to do things differently or in their own way could be something as simple as helping them figure out how to take public transportation. That took us a long time to learn, and it took several iterations, but we have learned how to do it in our house. And so nobody really thinks about that. We're fortunate in San Antonio, we have multiple options for public transportation for people with disabilities, but not everywhere do they have those options. So, all right, moving right along, we'll go to the next slide. Let's start with using inclusive language. Next slide. And inclusive language is really about focusing on a person so that we are giving them the respect they deserve, the dignity they deserve. We want to be accurate, and we want to make sure that they're able to understand us and interact with us in whatever way is comfortable for them. So a lot of that, just in a nutshell, involves avoiding any type of communication, written or verbal for that matter, that excludes them, that demeans them or puts them down. Maybe it stereotypes them. We don't want to stereotype. We don't want to limit. We want to make sure that everyone is respected, has the same opportunities as others, and that their diversity is embraced. Next. So one of the huge tenets of inclusive language or inclusive speaking is person-first language. And being as old as I am, I can say that now, being as old as I am, I come from a generation when I was a child where person-first language was not the norm. It was very, very common to say that kid with asthma, or that asthma kid, if you're a patient, that asthma kid in room 4. And things like handicap, things like special needs. We're going to talk about all of those in just a minute, but person-first language simply means we're going to place the person before any identifying characteristic. So if I am deaf or hard of hearing, I am Jen Fisher, who is deaf or hard of hearing. I am Jen Fisher with a hearing deficiency. However you want to phrase it, we want to put the person before we put the disability. Doing this just highlights to everyone around them and them individually that they are a person. They are a unique individual, and that's all they want to be. All anyone with a disability wants to be is just like the person next to them, individual and unique, and having their own personality traits. So we want to avoid that pitfall of singling them out or defining them in a way that we wouldn't define everyone else. And we can simply do that by putting them before the actual defining characteristic. Now, best practice. I have learned over the years, and this is now actually published, it's really best to ask the person, because I've come across multiple people who maybe they have a specific way that they want to be identified. And so if you're interacting with someone, it's fine to ask them how they want to be identified. I find a lot of times I grapple with how to address someone who has dwarfism. There's lots of demeaning terms out there in written and spoken language. And so there's a big push. Some of them want to be identified as little people. Some of them don't want to be identified as a little person. Some of them want to be called a dwarf because that's actually what they are. That is their diagnosis. But the best practice is, if you are uncertain, ask them. Ask them how they want to be referred to. So we're going to move forward in just a second, and I'm going to go through some slides that seem very, very simple, but it's a practice that I find very useful when you're trying to change your mindset or how you actually think about something. And I have some commentary for some of these slides, but I don't want you to think, oh, well, this is just filler. It's not filler. It actually works really well. And so we're going to go through some slides about how we can phrase different types of disabilities. All right, let's go to the next slide. So we're going to start with trying to think about, remember, person before the actual characteristic. So I work with people who have a disability, or maybe we work with people with a disability. Either way is the appropriate way to say it. My peers at work have really embraced this. We have done a lot of work in the last 2 years that I've been at UT to change the way that we state this. And then in my work in the pediatric realm of the nursing school, we run into a lot of children with disabilities. And, you know, he's not the kid, he's not the CP kid, he's the child who is 7 and has cerebral palsy. So just think about it that way. You can always say with and then the disability, or you can say they have a disability. Next slide. So when we talk about intellectual and hearing disabilities, I like to use the word with more than anything. This is the way that I have seen most commonly individuals with an intellectual disability or a hearing disability choose to be referred to. The only exception would be individuals who have a hearing disability who are fully deaf. Not sure if this is well known or not, but it is something that in my background I'm aware of. Individuals who are born deaf versus individuals who become deaf or hard of hearing later in life actually think of themselves as deaf with a big D or deaf with a little d. And that means if you are deaf with a big D, you are fully deaf and born into the community, and that is the only community that you have known. Your family might have other individuals who are also deaf within the family unit. Whereas if you acquire your hearing disability over your lifetime, you might be little d. I am little d, even though I use sign language sometimes, and I tell people that I am hard of hearing and I do wear hearing aids. I am still little d, and so I am not a part of that formal deaf community. So just something to think about when we talk about the written word and how we respect individuals with our written word as well. When it comes to intellectual disabilities, that has become such a hot topic. Intellectual disability can mean so many things, right? And we've gone from calling someone an individual with autism to an individual who has an autism spectrum disorder to now the current terminology is someone who is on the spectrum. And when you look at what on the spectrum means, it's so many things. It's a huge cloud of things that can happen, so or that can be diagnosed. So just know that they have their own way of wanting to be addressed, and we should be asking them how they would like to be identified. Next slide. Oh, I love this one. Okay. So persons with a visual disability or persons who are blind, this is something I've been trying to learn about myself. I do some work at a charitable organization on the side, and we have had more individual participants who have visual disabilities lately. And I knew I didn't know what I needed to know. And I also follow several social media accounts of different resources for individuals with disabilities. And I found something very interesting just yesterday, to be quite honest with you. And it was posted by the Workforce Solutions Transition Network. And it was written by someone with a visual disability. And she simply said, this is what you need to know about our community as far as our cane is concerned. This is what we need you to do when you're trying to warn us that there's a problem. And it was very interesting to read because getting that person's insight was so valuable to me. So they want to be identified as someone with a visual disability. That's just how they are. And so that was very interesting. When it comes to physical disabilities, I will always say individual with a physical disability or physical impairments. I personally prefer physical disability. And again, that could be personal preference. So we would want to ask that person how they want to be identified. Next. All right. Here's another way to talk about persons with intellectual disabilities. We have neurodivergent. And there is a growing subset of individuals who want their child to be referred to as neurodivergent over on the spectrum, or with autism, they would prefer neurodivergent. So that is an up and coming term that has been gaining traction, I should say. And so I hear that more and more, and it refers to a whole host of different diagnoses. So again, best to ask the person, right? I already talked about little person or people with dwarfism, but that was probably the first time that I actually thought, you know what, I need to dive more into this. I need to see what it is about that community of individuals that share that diagnosis that they really want us to know about them. And that's when I started learning about the back and forth between somewhat little person and somewhat dwarfism. So that was very interesting to me as well. Next. All right, then we have person with a sensory disorder. That could mean a lot of things. And it could be something as simple as one of our friends who is on the spectrum who just can't handle tags in their t-shirt. That sometimes really gets people. I have friends who can't handle socks. It does not matter what kind of sock you put on them, they cannot handle it. And so it could be something as simple as that, or it could be something even bigger. I've seen a lot of things fall up under this, but they would be a person with a sensory disorder. And then my very last example is, we're going to talk about this in just a minute, but a person with Down syndrome or a person with trisomy 21. Trisomy 21 is kind of an older term. I hear it more used with physicians, but in the community, I'm hearing person with Down syndrome is how they want to be addressed. I've been doing some work with the Down Syndrome Association of South Texas, and it's very interesting that whole community of individuals, how they are identifying themselves in recent days. It's very uplifting, actually. I had an aunt on my mother's side who is no longer with us, but she was born with Down syndrome. And so I grew up with that. And I have watched where we came from and where we are now with addressing individuals who have Down syndrome. And it's very interesting to watch. All right, next up. How do we include everyone in the conversation? So I just want to put a reminder out there, because it sometimes gets forgotten, that just because an individual is non-speaking, and that is the term I prefer over nonverbal, a person who is non-speaking can still comprehend the entire conversation. I know many individuals who do not speak, but they fully comprehend the conversation going on around them. They can express themselves and make choices. And I love when people give them the opportunity to be able to do that. It might be that they are using a communication or AAC device. And so it takes them a little bit of time to input the statement that they are trying to make and then have the actual device speak it for them. I have friends who use sign language. I have friends who use gestures. I have friends who use other creative means of communication. But just because they do not speak what they are thinking does not mean that they are not intelligent, does not mean that they cannot communicate with you. And it's just something that I'm very big about. The other thing that I like to tell people is, if you notice someone with an alternative way of communicating, please do not deprive them of that alternative way of communicating. Don't take their AAC device and put it where they can't get to it. Don't take their interpreter away. Whatever it may be, try and give them that access at all times. Some other common pitfalls I see when it comes to inclusion in the conversation, speaking over or speaking for someone because they're not answering fast enough for our liking. Ignoring slow responses. I talked about this. The AAC just takes time, and sometimes we have to be patient. And then equating silence with a lack of input. And that, I think, is the biggest one. So we don't want to just, because that person's not speaking back to us, they must not have anything to say. And that could not be farther from the truth in most situations. Next, please. All right, so words and phrases to avoid, and this is where I kind of stopped myself a minute ago. We'll start with the big one first, and that would be the R word. And if you are not familiar with the R word, we do not ever say the word retarded. That is something that I grew up with. My aunt who had Down syndrome, that was a very common word 40 years ago, but it is not a word that we use now. And yet it is commonly thrown around in everyday language like it is an adjective that we should all be fine with. And I personally do not condone use of the R word. Here's a controversial topic for you. The term special needs. 28 years ago, when my daughter was born, this was the term that everyone used. She's going to have special needs, and you're going to need to learn how to take care of them. Well, it's not that she has special needs. She has needs just like you and I do. They're just different in how we go about meeting those needs. And so people with disabilities have come to the thought and the desire that they do not want to be referred to as special needs. So we are trying to get away from using that terminology as well. One that I wasn't really, I've never used it, so I don't think about it. It is an older phrase, but saying blind to or deaf to, we should just use an alternative phrase. Just say they don't understand. They don't have to be blind to it. They don't have to be deaf to it. Oh, yes, I just saw in the chat, it says, or fall on deaf ears. Oh, that's an excellent, excellent example. Yes. These are things that we don't need to use. We can just say it very plainly. I'm sorry, she didn't understand. And then the last one that I'd like to address is wheelchair bound. This is such a defining phrase. And most people who are in a wheelchair do not want to be known as wheelchair bound. They might be dependent on their wheelchair for mobility, but in their minds, they're actually more free with a wheelchair than they are when they don't have it, because that wheelchair is their legs. They can ambulate, they can go places, they can do all the things. So they are not stuck, they are not confined. They can get out and do things. And so we try not to use wheelchair bound if at all possible. All right, next up. So how do we go from speaking and being inclusive to the written word? The written word is much easier in certain aspects. I find that speaking is very impulsive and we're doing it nonstop, right? But when you are having a chance to create something, a resource document, a pamphlet, an article, anything like that, you have that opportunity to go back and look at it and make it inclusive. And so these are just a few things. I left the link at the bottom of this slide. AbilityNet has a great resource for how to be more inclusive when you are writing. And you will see a lot of those examples in this PowerPoint. You'll see the PowerPoint is not very cluttered. It uses bullets when I'm using a list. The font is actually 12 point or larger. And things are just very well placed. And that gives everyone, even those with a visual disability, that maybe they just have very low vision and they can see it if they blow it up. That gives them the opportunity to be involved as well. What I love about creating written documents that are inclusive is the technology today. Technology today has built into it how to check your document to make sure that it is inclusive or ADA compliant. And that is one of the coolest things I have ever been a part of. You can literally go in, for example, in Word, if you go to the accessibility button or check accessibility, it will check your entire document and then give you recommendations for how you can make it more accessible. It doesn't mean you have to change everything, but it will give you recommendations for how to make it more accessible. For example, I ran my PowerPoint through the accessibility checker because I wanted to make sure the font was correct. Sometimes when we change our fonts into a different style, it makes it harder to read. And so I wanted to make sure that that was taken care of because this is not your normal Times New Roman font. We want to avoid acronyms, avoid jargon. We want to make sure we're using common terms that everyone can understand. And remember, the average US citizen or US resident, I should say, reads at a 6th grade level or below. So we don't want to write anything higher than 6th grade if we can avoid it, so that everyone has the opportunity to understand what we're trying to communicate. I see a question. Will you also address how AI can help with inclusive language? Absolutely. AI is up and coming, right? And AI is something that I am getting better about using. My children remind me on the regular that I am old, and I don't feel old, but as far as technology goes, I am in that older generation. And so I'm getting better at AI. But you know what I've learned about AI and making things inclusive? If you give the correct prompt to AI, it will help you make anything more inclusive. The more specific you are when you are prompting AI to help you create something, the better AI can actually help you make it inclusive. So if you are creating a resource, I'm just going to use a middle school, for example. If you're creating a resource as the nurse from a middle school that is specific to students with diabetes, you can tell AI, help me create a one-page document highlighting how to better care for your diabetes if you are a middle school student, and use inclusive language. And it will spit out what it wants you to know. And then it will ask you, do you want me to tighten it up? Do you want me to pare it down? Do you want me to rewrite it so that it focuses on this, this, or this? And then at the very end, it'll ask you, do you want me to put this into a PowerPoint or a Word document for you? And it will do all of the work for you. So definitely, you have to double check it. I'm not going to say to ever trust AI. You have to double check it, but AI can be an excellent tool for writing and being inclusive in your writing. All right, we can go to the next slide, and then we're going to stop right there for a minute. I think on the schedule, there is a option for discussion. Is there anything, questions, comments, or anything about any of the slides that I presented so far?
Thank you, Dr. Fisher. This is very important and very interesting. I'm learning a lot. I really like when you say language that promote respect and of course the trust, right? To have these communications, because sometimes people talk about it, but sometimes it's not possible because the culture, because many reasons we don't talk about it. I also think this is very personal. It may take me time to go to that point, but I will be there because it's gonna be slowly, but I will be there, right? But yeah, thank you so much for sharing that. Personally, I've been learning a lot. Thank you so much. But is there any question from our audience? It's very important and very important topic. Any question, any comment? Agree? Excellent presentation. Love that. A lot of thanks in the chat.
I see that, and I feel so good because I'm so passionate that sometimes I worry I'm getting too much onto people about it, but I want to touch on your comment, Dr. Romero, that it may take me a while to get there, but I'll get there, right?
Yeah.
And I can tell you personally from being a person with a disability, that's all we ask. All we ask is that you are trying to change your mindset and move in the correct direction. And I have not met a person with a disability yet who is not happy with someone who's just trying. As long as you're just trying, that's all they ask.
That's exactly right. Yeah, that is in my heart. And like I say, personally, I'm being there. So just try it. It makes a whole world difference because we at least we try. And then if it's not working, we're gonna try later again. And then we try later again. So we need to have that in mind. Dr. Stone, do you have something in the chat you would like to elaborate a little bit more?
Oh, I was just saying that these are concepts that are also true. Maybe you don't have a disability per se, but you have a chronic disease condition, and people with chronic conditions tend to be defined by that in terms of, how they're referred to in the healthcare system. So, and I know they don't like that, you don't want to be defined by your disease. So just making the point that the same concepts would apply in that case.
Absolutely. Great point.
Yeah, and along with that is pain, right? Because you don't see pain.
And pain, chronic pain is a disability in some rights. It is recognized as a disability. And you're right, you can't see it.
You cannot see pain. So it's a backpack that we have in the back and nobody sees that. It's something, I always say, this is a backpack and nobody sees that. And how heavy it is depends on each person.
Oh, I love that comment. It's an ongoing learning process for my generation. Amen. I think I'm probably in your generation, maybe. It's something you really have to put your mind to. But again, all they ask is that you try.
Just try. Every day is an opportunity. I always say every day is an opportunity. Another comment, Ludi, I'm practicing, very important to include everyone. We promise to read all the message. Yeah, language, it is important language that, but also you said something about silence, right? It also communicates when people are in silence. It's a communication.
Yep. So there's so many ways to communicate. And I think now more than ever before, society is open to that. But then there's also a little bit fear of the unknown, if you will. And I don't really know that, and I'm not comfortable with it. So I'm just going to try and stay away from it because I don't want to offend someone. When in reality, what we need to do is say, I want to embrace what you have. How can I do that? Tell me what I can do for you. And most people, when you say that, are very open to whatever it is you want to do to help.
Yeah, there is another also comment.
Oh, I love that. I just
Right?
thought, yes. And I actually love that you said that because that is another word from when I was a child. I was called handicapped on a regular basis. My mother was called handicapped on a regular basis. And to me, the second half of that word cap implies that I have a limit, right? It implies maybe I'm stuck at a certain place that I can go. And I just I don't subscribe to that. I don't identify as that. So I'm glad you said that because yes, I don't use that word if I can avoid it.
Yeah, I
Always
agree
ask for
100%.
permission. Yes, always ask for permission.
Mhm.
May I help you? May I ask how to address you? That's a great comment. Yes.
Very good comment, because help is always appreciated, but always has to be in some way that is kind and, like you say, the word of respect, that create trust. Those are the values of the health confianza.
Yep.
Another comment or question, I don't see anything else. So, Dr. Fisher, maybe we can go to the case, if that's okay to you.
We're gonna leave this on the screen, but there is one comment that I want to address real quick. It says, as a person who is ailed by an invisible disability, it's difficult to speak about it, and it constantly alters my physical abilities. There's always are you okay? And I love that because, again, you're asking, you're not trying to do for, you're not assuming anything. And so thank you. I think it's Gigi. I hope I'm saying that right. Thank you, Gigi, for saying that, because yes, you can always ask someone, are you okay? And give them an opportunity to tell you, yes, I am, or no, I'm not. And if they say, yes, I am, then this is a great way to ask permission, right? Is there something I can do for you? And give them the opportunity to say, I'm good, I just need 5 minutes, or yes, can you please do X, Y, and Z? So great point, great point. All right, so let's do a quick case study. I purposely created this slide a certain way so that I could point something out to you all. If you notice on the right-hand side of this slide is not ADA compliant, and I did this on purpose. This background specifically with the black words going across a very busy background would make this slide title very difficult for someone with low vision to pick out the actual words. Someone with dyslexia might have a difficulty reading the title of this slide. So while I did this on purpose, and I want to tell you that, It is not ADA compliant, and I wanted to show you a good example of what is not ADA compliant. So the checker did call me out on this, and I purposely left it for you all. But let's dive right in. Again, this is a story that is slightly altered. Names, the age is altered, but the actual story is a true story that I was a part of. And so I thought that it was a great way to demonstrate all of the things that we have talked about today. So Marcus is a 22-year-old man with cerebral palsy who uses a wheelchair and communicates primarily through a tablet-based augmentative and alternative communication device. That's the AAC. He understands spoken language fully, but is nonverbal or non-speaking. Marcus lives with his mother and recently enrolled in a community-based chronic disease management program. They're having a case planning meeting for Marcus. It is being held at the community health clinic. Those present at the meeting are a nurse care coordinator, a community health worker, a social worker, Marcus's mother, and Marcus, who is present in his wheelchair with his AAC device mounted in front of him. The team begins to discuss Marcus's medication, his diet, his transportation barriers, and his home support needs. Throughout the meeting, the following things happen. Providers direct questions to Marcus's mother, talking over and around him. The social worker actually says, does he understand what's happening with him? To his mom. The nurse states, we'll need mom to make sure he sticks to the plan. No one at any point in time paused to offer Marcus the opportunity to respond using his AAC device or other means of communication. At one point, Marcus did begin navigating on his tablet, but the discussion continued without acknowledging his move to try to communicate. By the end of the meeting, the team had finalized a care plan that included dietary changes, home health referrals, and an adjustment to his transportation. Marcus was never able to directly contribute to the discussion. As the meeting was concluding, Marcus types on his AAC and sends a message. It reads, I want to talk. We can go to the next slide. So I'm going to put this up here because this is just kind of how I teach the students as well. Sometimes we don't realize what less inclusive versus more inclusive might be. And that's okay because we're all learning. We're all on this journey together, right? I remember being at this particular meeting. I was an observer, so I was not one that should have been standing up and saying anything. I was told I was an observer and I was to sit in the corner and do nothing. And as someone who has lifelong exposure to individuals with disabilities, this infuriated me. I think the first thing that I literally remember I did this, I turned my mouth off because I wanted to get very upset when everyone looked beyond Marcus and said, does he understand? And that's just very demeaning when you're speaking about someone who has cerebral palsy. Doesn't mean that they can't think. It just means that their muscles don't work right, right? So more inclusive would have been asking Marcus how he felt about the plan. Instead of saying, mom's going to manage his diet, Marcus, how do you want to be involved? What would you like to tell us about your diet? There's that term I told you I don't like to use. He's wheelchair bound. Actually, Marcus uses a wheelchair. That's how he is mobile. Special needs patient. Marcus is a patient with cerebral palsy. And then talking to his mom over and around him. This is something that I teach everybody I come in contact with when I'm teaching how to include an individual with a disability in a conversation. I teach them to speak to the individual first. And so I don't really care how old they are. If I am, for example, working at the nonprofit that I work with, which serves individuals with disabilities, I will always introduce myself to the participant first, whether it looks like they can understand me or not. And then I will introduce myself to the caregivers, the parents, whoever it is that's dropping them off. And that is a dignity and respect gesture right there. And so I will always do that. I always make healthcare workers who are addressing my daughter. She likes for me to go to her appointments with her. I will always have them address her first. She's the patient. She's 28 years old, and she only wants me there in case she doesn't know how to answer a question or she doesn't understand something. I am the backup. So just a little tidbit, always speak directly to them first, and you can't go wrong, even if they can't understand you. So one last thing I want to do is I want to look at how could this conversation have gone better? I'm reading a comment. Oh, yes, that's an excellent. Oh, the pit is doing some fabulous work in this area. The comment says the pit showed an interaction with a medical resident and a person who is deaf. The resident was talking to the interpreter instead of the patient, and they had to teach her to address the patient first. Yes, so many times people think when you are using an interpreter, now that means either the video interpreter or the live interpreter, the person standing next to them, people think that they have to talk to the interpreter. Will you please tell him that I need to know his medical history? That's not the way it works. And it's actually very demeaning. So that's a great point. Talking to the actual person, the interpreter will do their job, even if you are not looking at them. Okay, let's flip to the next slide. And I want to do what I call rewind and replay. Let's look at how this could have gone differently for Marcus and his mom. So Marcus attends the same care planning meeting. This would be the second meeting with the nurse, the community health worker, the social worker, and his mother. And at the start of the meeting, things went a little bit differently the second time around. The community health worker said, "Before we begin, Marcus, what is the best way for us to communicate with you today? And then we'll make sure we allow time for you to respond with your AAC." Now, I will admit, they didn't exactly say respond with your AAC, but this is what I would say if I was in that situation, because why? I can see the AAC mounted to his wheelchair, and he uses it to communicate, right? But it's perfectly fine just to say, what is the best way for us to communicate today? And then Marcus may say, I would like to use my AAC. And you can go ahead and say, okay, just let us know if we're going too fast for you. After that, the nurse addressed Marcus directly, asking Marcus how he felt about care management of his disabilities. How's it been going? What do you think we need to do differently? Marcus had a good 10 minutes at this point to be able to respond using his AAC, and he did not hold back. It was really empowering to see him say the things he wanted to say. So Marcus actually, this is one of the comments. Marcus typed, "I want to choose for myself. I don't like when people decide for me." And this is so often what happens with my kiddo. People think that she doesn't want to choose for herself because her mom's there with her and she's 28, so she must not want to be the one to make decisions. And that couldn't be farther from the truth. So the community health worker actually thanked Marcus for sharing his thoughts and said, let's build a plan around what matters to you. And that's exactly what they did. It became a team effort. And the social worker went on to further ask, is everybody here okay? Like, who do you want on the team? Do you want all of these people involved on the team? And Marcus's, the bottom line, what his comment was, my mom helps, but I make the decision. And if you read back through this replay, Marcus was very clear multiple times that he is capable of making decisions and he wants to make those decisions for himself. And he has help doing it when he needs it and when he wants it. So I thought that was very powerful. At the end of the second meeting, when everything was said and done, everyone was getting ready to leave. It was very interesting because Marcus told the social worker, "Thank you for asking me." So that just reiterated to the social worker that Marcus felt heard, Marcus felt included, and Marcus was grateful for being a part of the team that was making decisions for him. I think that might be the last slide. It is. That is the last slide. So I did give you references and links. I am guessing that these can be shared out on the Echo page where you come to join the meeting if anyone would like them. I appreciate being asked to come and speak today. Again, this is very near and dear to my heart, and so I appreciate being able to be a part of this. Back to you, Dr. Ramos.
Thank you so much, Dr. Fisher. I really like the story of Marcos because, and indeed, it just fulfills when you say language that promotes respect, and at the end, he has kind of the trust to say, "Thank you so much for asking me." How important is just taking that into consideration, right? That it's very important to have respect, to create this communication, and because we all have a different situations, right? And we're living with different challenges. Another comment, it says, excellent presentation. You have a lot of excellent, awesome, and thank you, Dr. Fisher. Thank you so much. And I'm an echo on that. I really like your presentation. We almost are in finish our time. Is there another comment? Another great presentation. Another important reminders in the chat. Thank you. I really love the presentation. Dr. Rosenfeld is our leader specialist. As a part of the ECHO, we have a summary at the end.
Yeah, I want to just echo what everyone has been saying. Dr. Fisher, thanks so much for sharing your knowledge and expertise with us. I think it's so important and really reinforces so many things that we've been discussing in this communicating with Confianza Echo, regardless of who you are engaging with. We're looking for actions and language that promotes dignity and respect. Full stop, right? That's what we're seeking for. I'm going to share a quick anecdote and then a summary. Many of you have probably heard me share this. Deep in the COVID-19 pandemic, we were hosting town halls as a team to promote COVID-19 vaccines and just engage in dialogue with community. And we went to a location where there were some people present who were against the vaccine. Folks were trying to keep them out. We invited them in. Long story short, they had an opportunity to share their perspective. Dr. Ruth Berggren, who used to be with our institution and with Health Confianza, answered, showed respect. And as they were leaving, they came up to any one of us with a shirt on that said Confianza and said, "Thank you," because we did not shoot them down. We did not tell them that their opinions are wrong. We showed them, as you said, Dr. Fisher, dignity and respect. And so whether we're working with people with a disability that we can see or not see, this is what humans crave, and that's what we need to be striving for. So in summary, we talked about bringing inclusive language and actions, both written and spoken. We want to help people feel like they belong. So this is kind of reinforcing our core health literacy principle of acknowledging perspective. We learned that a quarter of the U.S. population has some form of a disability, and that really the best way for us to effectively communicate with and for people in this population is to use person first language. So this is a person with, and as Dr. Stone mentioned, whether it's a disability or a health condition, it doesn't matter. We don't characterize people by the diagnosis or a characteristic. We describe them as humans, as people. I learned about big D versus little d deaf, and I appreciate learning that. That was very interesting for me. We learned 4 of the words that we should not use: the R word, special needs, blind to or deaf to, and wheelchair bound. And then finally, the kind of key piece for me that I hope people will also take away is it's really incumbent upon us to be observant. check your biases, and really at the end of the day, get curious. Like just be curious about the person that you are interacting with, because then you can show them dignity and respect. So thank you, Dr. Fisher. Really appreciate you sharing your time with us today.
Thank you.
Thank you, Dr. Rosenfeld. That's a wonderful summary. Thank you, Dr. Fisher, to be with us today. That was really light in hearing you today. And thank you, everyone that joined our session today. Those sessions are possible because of you. Please put your comments, feedback in the chat. You also want to see in the chat to learn continuing education credits and certificates of participation. Please check that and click on that link. And we're going to see you in 2 more weeks. So please take care and have a wonderful rest of the day. Thank you so much.
Thank you.